One prescription for a simple sinus infection destroyed my gut for 5 years. Within days of finishing antibiotics, I developed chronic diarrhea, bloating, and debilitating fatigue that doctors couldn't explain. I wish someone had warned me what antibiotics really do to your microbiome. Today, I'm sharing what I learned so you don't make the same mistakes. Antibiotics save lives, but they also destroy your gut bacteria indiscriminately, killing good bacteria along with bad. Nobody told me this could cause years of health problems. Nobody told me how to protect myself. Here's what happened and what you must know. What happened to me? I took a 7-day course of broad-spectrum antibiotics for a sinus infection. Within 3 days of finishing, severe diarrhea started, then came bloating so bad I looked pregnant, crushing fatigue, brain fog, anxiety I'd never experienced before. I went back to my doctor. He said it was probably a stomach bug and would pass. It didn't. Weeks turned into months. I saw 5 different doctors. They ran tests. Everything came back normal. Finally, a functional medicine doctor tested my gut bacteria. My microbiome was devastated. Beneficial bacteria were nearly gone. Harmful bacteria had taken over. I had developed SIBO and C. difficile overgrowth from the antibiotics. It took 5 years of targeted treatment to fully recover my gut health. 5 years of suffering because of one prescription. What antibiotics actually do. Antibiotics are designed to kill bacteria. The problem is they can't distinguish between harmful bacteria causing your infection and beneficial bacteria protecting your health. One course of broad-spectrum antibiotics can wipe out 30 to 50% of your gut bacterial diversity. Some species never return. Your microbiome may be permanently altered. The beneficial bacteria that produce vitamins, regulate immunity, and protect your gut lining are destroyed. This creates space for harmful bacteria, yeast, and pathogens to overgrow. The C. Diff Nightmare. C. Difficile is a dangerous bacteria that causes severe, sometimes life-threatening diarrhea. It normally can't establish itself because beneficial bacteria keep it in check. But when antibiotics wipe out good bacteria, C. diff can take over. This is exactly what happened to me. C. diff causes watery diarrhea 10 to 15 times daily, severe abdominal cramping, fever, and dehydration. It's incredibly hard to treat because it's resistant to most antibiotics. The standard treatment? More antibiotics, which often makes it worse. About 30% of people who get C. diff after antibiotics will get it again. Some people battle recurrent C. diff for years. The long-term consequences. The damage from antibiotics extends far beyond immediate digestive issues. Your immune system is compromised. 70% of immunity lives in your gut. When gut bacteria are destroyed, immune function plummets. I got sick constantly for 2 years after antibiotics. Mental health suffers. Your gut bacteria produce 90% of serotonin. When they're destroyed, depression and anxiety follow. My anxiety became debilitating. Nutrient absorption fails. Good bacteria help you absorb vitamins and minerals. I developed deficiencies in B12, iron, and magnesium despite eating well. Chronic inflammation develops. Without beneficial bacteria producing anti-inflammatory compounds, inflammation runs rampant. My joint pain and skin problems appeared after antibiotics. What I wish I'd known. Before antibiotics, question if you really need them. Many infections are viral. Antibiotics don't work on viruses. Doctors often prescribe them anyway to satisfy patients or as a precaution. Ask for a culture test. If it's bacterial, get a culture to identify the specific bacteria. Request narrow-spectrum antibiotics that target only that bacteria instead of broad-spectrum that kill everything. Try alternatives first for minor infections. Garlic, oregano oil, and other natural antimicrobials can handle many minor bacterial infections without destroying your microbiome. Take probiotics alongside antibiotics if you must take them. High-dose probiotics, especially Saccharomyces boulardii, protect beneficial bacteria. Take them 2 hours away from antibiotic doses. Eat fermented foods during and after antibiotics. Sauerkraut, kimchi, and kefir provide beneficial bacteria to replace what antibiotics destroy. What I wish I'd known. During antibiotics, take the full course as prescribed. Don't stop early, even if you feel better. Incomplete courses create antibiotic-resistant bacteria. Space probiotics 2 hours from antibiotic doses. Taking them together means antibiotics kill the probiotics immediately. Avoid sugar and processed foods. These feed harmful bacteria and yeast that overgrow when good bacteria are depleted. Stay hydrated. Antibiotics can cause dehydration and digestive upset. What I wish I'd known. After antibiotics, continue probiotics for at least 3 months after finishing antibiotics. Your microbiome needs time to recover. Take high doses of diverse probiotics. I needed 50 billion CFUs daily with at least 15 different strains. Eat prebiotic foods. Garlic, onions, asparagus, and resistant starch feed beneficial bacteria trying to reestablish. Add fermented foods to every meal. These provide diverse bacterial strains that repopulate your gut. Consider antimicrobial herbs. If you develop overgrowth, I needed oregano oil and berberine to eliminate the harmful bacteria that took over. Work with a functional medicine doctor. Standard doctors don't understand microbiome recovery. You need someone who specializes in gut health. Get tested. Stool testing reveals exactly which bacteria are overgrown and which are depleted. This guides targeted treatment. The recovery protocol that worked after 5 years of trial and error, here's what finally healed my gut. High-dose probiotics with at least 50 billion CFUs and 15 strains, taken daily for 6 months. Saccharomyces boulardii specifically. This yeast-based probiotic is resistant to antibiotics and particularly effective against C. diff. Antimicrobial herbs to clear overgrowth, oregano oil, berberine, and neem for 6 weeks, prebiotic foods daily, garlic, onions, and resistant starch from cooked and cooled potatoes, fermented foods with every meal, sauerkraut, kimchi, or kefir, bone broth daily. The collagen and glutamine repaired my damaged gut lining, no sugar, alcohol, or processed foods for 3 months. These feed harmful bacteria. Stress management. Stress worsens gut problems significantly. This protocol took 6 months to fully restore my gut health after 5 years of suffering. How to protect yourself. Only take antibiotics when absolutely necessary. Not for viral infections. Not for minor issues that might resolve on their own. Always take probiotics alongside antibiotics. This single step could have prevented my 5 years of suffering. Eat fermented foods daily during and after antibiotics. Be aware of C. diff symptoms. If you develop severe watery diarrhea after antibiotics, see a doctor immediately. Early treatment prevents chronic infection. Track your gut health after antibiotics. Any ongoing digestive issues, mood changes, or fatigue warrant investigation and treatment.